Hello, today we'll be doing a seated cervical digit pillar push. Before I start with the adjustment, we just want to do some joint play or joint evaluation to find which joint is restricted. And to do so, what I'm going to do is place my hand on your head if that's okay.
Yep.
I'm just going to rotate your head away. I'll be using my index and my middle finger and my digits. I'm going to be pushing on the pillars P to A, just stressing them. Just going down the cervical spine. Good. Go the other way. Same thing on this side. Good. And then once I find a restriction, in this case, I found one on the right, on the C5. So before I get started, I'm going to have the patient get into my strike zone. And to do that, I'm just going to have you scoot down a bit for me, please. Thank you. So patient position is seated. Doctor is behind the patient on the side of the segment. So on the right side, my contact is going to be my DIP, which is this part of my finger. I'll be placing that contact on the patient's pillar. To do that, I'm going to count up from C7, go up 2 segments on the spinous process and come laterally to the pillar. I'm then going to ask the patient to go ahead and flex her head into my hand. Thank you. Then my indifferent hand or supporting hand is going to be on the side of the head. I'm going to go ahead and slightly rotate the patient's head. I'm going to also step around and laterally flex. And then line or drive here is going to be P to A. And making sure that my arm is nice and parallel to the ground, going across the body.